Hi, this is Dr. Danaya from Radiant Pelvic Health. We're here with Joy Bouchard at Lotus Rose Counseling. Joy, can you tell me about your business?
Yeah, so we are a mental health therapy practice. We specialize in seeing women for a variety of different reasons needing mental health therapy.
So what specifically do you specialize in with those types of women?
So we do a couple of different things. So some of our clinicians specialize in doing perinatal mental health, and so a lot of postpartum depression or any perinatal mental health disorder, birth trauma, infant loss, anything that has to do with like the postpartum period. So we have a couple of clinicians that do that, and then we also do women's mental health in general. So things like navigating difficult relationships, abuse, childhood abuse, sexual abuse, physical abuse, things like that. So anything that really pertains to women in general, we have clinicians that specialize in all of those things.
Awesome. So why did you choose this profession, Joy?
I chose this profession because I'm a woman and I know what it's like to go through really challenging periods of life, specifically grief and loss and postpartum mental health disorders. So I myself have 3 kids, and with each of them I have my own journey with birth trauma and postpartum depression and anxiety. And so I know what it's like to need help in that period of time and to be looking for someone who you can talk to about it and give you some guidance of how to navigate that. So I really wanted a place that not only specialized in that, but felt like a very safe place for women to go, especially women who have experienced traumatic events. I know that it's hard sometimes to go and just talk to anyone about that. And so I wanted to create a place that was very safe, that just felt very warm and welcoming. And all of our clinicians are very trained in how to help specifically with a lot of different women's issues. And I wanted it to be kind of a safe haven.
Yeah. Well, you've done a great job. Your clinic is beautiful.
Thank you.
It has a really nice feel to it.
Thank you. I put a lot of work into it.
Yeah. So do you have, with that said, do you have a favorite thing that you like to treat?
Yeah, for me, there are 2 things that I really love. I have a special place for. One of them is infant loss, just with my own life experience, not losing an infant, but in helping women who have lost an infant or like a newborn. I love working with women who have experienced that. It's just a very hard time of life that I love to hold space for. And then the other one is childhood abuse, helping women who have experienced that in their childhood and then now are trying to navigate that as a lot of times as moms. When it kind of comes up, resurfaces, that's one of my favorite things. So
that sounds like a really important thing, right?
Yeah.
Like a lot of people, I'm sure, need that. They don't even realize that they need that.
Yeah, you don't know you need it until you know.
Yeah.
It kind of pops up in some of the hardest times for sure.
Yeah.
That's actually what I found with postpartum depression. Like when I first started working in postpartum depression, people would come in for that, but we'd find that there's a lot of stuff from childhood and from past that they hadn't processed yet. And so I kind of found the 2 really overlap a lot anyway. So yeah.
Yeah. So what makes Lotus Rose Counseling different than other providers, do you think?
I think that just our specialized approach in seeing women, a lot of places will say, we see women in postpartum or like perinatal periods, but they just have kind of a wide variety of what they see. And with us, we really specialize in seeing women and like women's issues, not just women's issues and all these other things, but really that is what we do. And we take a lot of trainings that specifically gear towards those things.
I love that. So what type of certifications or trainings do you and your staff members have?
Yeah, so all of us are trained in some sort of trauma treatment. So many of us have EMDR, which is eye movement desensitization and reprocessing. There's a whole training for that. And then there's ART, that's accelerated resolution therapy. It's very similar to EMDR, but it's a different training that you go to. And so all of us have some sort of trauma training in that way. A lot of us do what's called IFS or internal family systems. That's a different model that we use that is also really helpful for trauma and really just navigating life in general. And experiential therapy, that's one that we're kind of diving into. All of us took a training. We all loved it, and so we're just diving into that a little bit more too.
Cool. Very cool. What are some common misconceptions that you hear about therapy?
I think one of the biggest ones that I hear is, kind of the vibe that I get from people is they think it's going to be fast, that they think it's a fast fix for things. And it's not. There's a lot that goes into it, and it takes time not only to build a relationship with your therapist, but also to just heal things from your past. So I think one is that it just takes more time than people usually think. The other myth that I hear a lot is that it's just talking and it's something you could just do with a friend. And there's so much more to it than that. There's so much more than just sitting and having a conversation with someone. There's a lot of training and hours and dedication that it takes to be a therapist and to show up in a therapist role. So it's not just talking, there's a lot more to it.
Yeah, and I mean, just hearing you talk about all the different trainings that you do, like I'm sure it just really makes you stand out from not only just a friend, but like just the other, providers around here too.
Yeah, because there's so many trainings out there, but not only are we required to take a certain number of trainings every year, but also we gear ours toward the things that we are the most passionate about.
Yeah. What does a typical client journey look like?
I would say usually we see people for between 6 to 12 months. That when you first get started with therapy, sometimes it feels a little awkward, sometimes it feels uncomfortable. And so our therapists are really trained to build rapport with our clients. And so at least for me specifically, I like to have a very open dialogue. I like to provide a lot of information, a lot of education, just to kind of get people comfortable and like understanding terms and things like that. But then also doing a lot of like processing and helping them start to learn how to open up and be vulnerable. So I would say the first little bit is about educating and kind of getting comfortable with each other. And then I would say that's really when the deep work starts. And so I like to have, I mean, for me personally, I think that we add a little fun and humor in there too, because it's hard. We're talking about really hard topics. And so I like to have a really open relationship with people to just, feel like they can be comfortable and talk to me about whatever they want.
Yeah, absolutely. So what would you tell someone who's on the fence on whether or not they feel like they should come to therapy?
I would say call around and see if you can get a 15-minute consultation. We do free 15-minute consultations. So basically you can call in and say, I just kind of want to know what my provider is like, what these clinicians, what their personality is like, what they sound like, what they look like. And so you can do that we do that over telehealth. And I would say just call in and meet with someone, ask a question, ask if what their approach to therapy is, ask what, trainings they have, what education they have. And sometimes just having that initial conversation opens that door to say, look, like it's easy, this is fun, this is a normal thing to do. So I would say ask about consultations, and I would say try it out, just see what it's like. You don't have to commit to anything. There's no contract. You don't have to commit to it for 6 months or whatever. You can come to a session, and if it's not the right fit, then find somewhere else.
Yeah. So they have 5 stars on their Google reviews, and if you're in the area, definitely check out Lotus Rose Counseling.
You can visit us at our website, lotusrosecounseling.com, or call our phone number 801-642-4244.